live session is not done. So today we will do in the afternoon. So let us start with the 20th episodes of Phatak Materia Medica live series. Today we discuss the drug is ALUMEN. So as given by Dr. Phatak. So let us some differentiating point, or there are two close drugs, ALUMEN and alumina. So these are two different molecules we must understand basically. So alumen is a potassium of alum. Chemically it is a potassium aluminium sulfate. So chemical formula is KAI in bracket SO4 in bracket 2 12H2O. So it is a double sulfate of potassium and aluminium. Double sulfate of potassium and aluminium. And alumina is aluminum oxide, simple. It contains aluminum oxide A2O3, it's the formula. So it contains only aluminum without potassium or sulfur. So alumen has potassium, sulfur and aluminum, and alumina is only aluminum oxide, only aluminum. Okay, so the this is the basic differentiation we must need to know. So according to Phatak, we will go to the remedy alumen, and next part we will do the alumina. So alumen is, according to Dr. Phatak, induration and paralytic weakness. A great theme or core of the this remedy is induration, paralytic weakness. Induration and paralytic weakness. This is not a physical hardness. This hardness of tissue plus dryness plus loss of tone. In alumen, hardness of tissue plus dryness plus loss of tone. So Phatak clearly tells us that in alumen, muscles are weak, gland becomes hard, organs lose elasticity, every, everything become tight, dry and bound. So alumen is not an acute fleshy remedy. It is a slow, long, deep acting remedy. Especially useful in old people, chronic catarrhal state, long standing cases of constipation, indurated glands and organs. So whenever there is a case of chronic, dry, hard and exhausted, alumen must be come into our mind. So let us understand the personality or essence of the alumen. As imagine an old rubber pipe. Earlier it is a flexible, now it is a strip, dry, cracked appearance, water passes with difficulty. Like a old rubber pipe. That is aluminum. So inner pattern is everything is tight, nothing flows freely, no elasticity, no reaction power. So this is a modern example. So patient may say that in our clinic, doctor, nothing comes easily, stool can't come, mucus doesn't come, voice doesn't come, energy doesn't come, life is itself become a constricted or closed. So in alumina, patient don't release, they remain hardened, retain and harden. Mental picture of alumen's mind is subtle and not dramatic. In key, Dr. Phatak describes it as doubting nature, doubting nature, nervous tremors from bad news, lectophobia, fear of public speaking or reading aloud. So it is not anxiety or anticipation like argentum nitricum. This is a weakness of nerve. So bad news leads to tremor. Thinking of diseases leads to palpitation. Fear leads to constriction. Mind and body shows the same pattern. In alumen, even though feeling tight and Dry. So, lectophobia is a key theme of Alumen. So, how can we understand the lectophobia? It's a fear of reading aloud. Loud reading is fearful. Fear of public speaking. Voice fails. Throat tightens. Aphonia appears. This is directly connected with relaxed uvula, indurated tonsils, spasms of the esophagus, that leads to mind complaint, then throat complaint, then voice. So physical general symptoms of the alumen is sensitivity to cold. Cold air leads to skin roughness, cracks, chaps. Cold exposure aggravates. So this patient doesn't tolerate exposure. Their tissue is already been a lack of vitality. Phatak clearly mentioned that paralytic weakness of muscle. This is not a sudden paralysis. This is a slow loss of strength, especially during the menses, in old age, after chronic diseases. So the key idea is weakness and hardness, not a placidity. In sleep symptoms, aggravation during sleep, hears every noise in the sleep, nervous system is weak, not a calm. Sleep does not uh, refreshes. In modality, as early as I said, cold, aggravation from cold, aggravation during sleep, lying on the right side, and bad news. Cold, aggravation sleep, lying on the right side, and the bad news. Ameliorating symptoms, cold water, especially for headache, pressure, and opening eyes for the vertigo. So, always come right sided aggravation for the alumen. So the peculiar symptom first comes to the alumen is the constipation. Constipation is the most aggravated kind. Let us understand it in this aggravation of the alumen. No desire for days. Stool dry, hard, marble like. Stools come out, but rectum feels full, still feel full. Long lasting pain and burning after stool. This is a rectal inertia and induration. So this is seen in elderly patients, in the cancer of rectum and cancer of uterus, chronic sedentary patients. So it is not a specific remedy for constipation. It is not spastic constipation, not painful to urge. This is a dead rectum feeling. Alumen passes stool but never feels empty. Another keynote feeling of alumen is a constriction. There seems to be appear in everywhere the constriction. It seems to appear in throat like a band, limbs as if tired, chest as if tight, mind as if constrained. So when the patient repeatedly uses words like tight, bond, stuck, held, then we must think of alumen. Throat and esophageal symptoms very characteristic: indurated tonsils, elongated and relaxed uvula, scraping sensation, spasm of the esophagus. Patient says that doctor's liquids don't go easily, even water becomes difficult. May end in complete aphonia or voice failure. Again, weakness with constriction. In respiratory system, mostly aged people's Phatak specify that adapted to old people suffering from bronchial catarrh. Copious ropey expectoration, aggravation in the morning, chest is weak, mucus is expelled with very difficulty. So no loose cough, no free expectorations, sticky, stringy expectoration. In hemorrhages, bleeding from leech bite, bleeding with large clot, hematemesis in hard drinkers, rectal bleeding with clots, so dry system, but when it bleeds in the clots. In female complaints, induration of the cervix, hard mammary glands, chronic yellow bland discharges, watery menses, hands weak during menses, always connect induration, always connect the female system with induration, weakness, yellow discharges. So, in eyes and ears symptoms, we must say that after cataract surgery, prolapse of iris, purulent otorrhea, alopecia, eczema on the back of the penis and scrotum, useful after eye and dental operation. Post-surgical weak healing with hardness. So where the hardness of the skin and after surgical healing is delayed, then we must think of ALUMEN. So, in day to day modern science practice, when the alumina we should think of or correlate with in chronic functional constipation, rectal inertia, IBS, mainly constipate dominant IBS, elderly constipation with no urge, rectal or uterine cancer, chronic cervicitis with induration, benign cervical hypertrophy, non-offensive yellow leukorrhea, in respiratory chronic bronchitis of elderly people with morning expectoration, in ENT functional aphonia, chronic tonsillar hypertrophy, spasmodic swelling difficulty. So the prescribing totality of the ALUMEN, we must say 8 to 10 points. Remember, chronic condition, elderly or long standing pathology, hardness and induration of the tissues, dryness everywhere, sensation of constriction or band, extreme constipation with incomplete feeling, yellow bland discharges, weakness of the muscle, sensitive to cold, mental symptoms doubtful, nervous from bad news. So these are the points. So we must differentiate the ALUMEN from many more remedies that we must be differentiate. Firstly and foremostly, ALUMEN with alumina. So both have taken mistakenly similar looking remedies. So uh, say that both remedy has deal with constipation, dryness and chronic states. But ALUMEN have induration, dryness, constriction, hardness, structural weakness, incomplete evacuation and elderly chronic state. While in alumina, coordination is difficult, slowness, confusion, delay, neurological inertia, cannot expel, and developmental delay. These are the differences. When the problem of that body has become hard, think of alumina. With problem that the body has forgotten how to act, then alumina. So alumina harden the structure, ALUMEN harden the structure, alumina confuses the function. Alumina is the main issue. Alumina has the main issue of loss of nerve coordination. Rectum does not know how to expel stool. There is hesitation, confusion, delay reaction. It is a neurological problem in the alumina. In ALUMEN, here is a rectum does not push, stool does not come out, but the patient, when stool come out, patient says that stool is passed, but still I feel rectum is full. That is this is not nerve confusion. This is hardness and induration of the tissue. So alumina cannot expel, ALUMEN expel but never feels emptiness. So these are the differentiating point between alumina and ALUMEN. Another remedy, ALUMEN with plumbum metallicum in paralysis comparison. Both have constipation, weakness, paralytic tendencies, but plumbum has paralysis in deep. Plumbum's paralysis is deep, progressive and retracting. There is colic, drawing in, pulling sensation. Patient looks withdrawn, mind is depressed, there is inward shrinking, atropies. ALUMEN has paralysis is slow, mild, structural. Muscles are weak because of tissue have lost their elasticity. No violent cooling, no pulling pain, no pulling sensation, just stiffness and tightness and hardness. So plumbum pulls inwards, alumen tights and hardens. Another remedy we must differentiate with alumen is the carbovegetales. So weakness differentiation, both remedies have old action in old people, chronic cases, long standing diseases, but the vital state is completely different. Carbohydrate patient is collapsed, life force is almost gone, patient wants air, fan, windows open, discharges are offensive, everything smells bad. In alumin, patient is weak but still hold structure. Discharge are yellow, bland, and yellow, bland, not offensive. Cold, cold affects the patient badly. There is dryness and hardness, not a collapse. So carbo is burn out, alumen is dried out. Another remedy that should be distinguished between alumen is Baratacarb. Both have hard glands and chronic state. But again, inner picture is different. Baratacarb is mentally childish, dwarfish, insecure, fearful, undeveloped emotionally. Alumen patient is doubtful, nervous, weak, not childish. When the glands are hard and mental immaturity, think of Barata. When glands are hard with dryness, with constriction, think of alumen. So, when there is a nerve problem, collapse and induration, the thinking is that problem with nerve, think of alumina. There is collapse, think of carbovage. Retraction, think of plumbum. And hardness, dryness and constriction, think of alumen. So, in alumen is a remedy of structure, not a sensation alone. In related remedy, as said earlier, alumina, nervous counterpart, plumbum, paralysis with constriction, barataka, glandular induration. Another remedy is calcarea plur, hard glands, chronic induration, nitric acid, indurated ulcers. So think of group of these remedies. Potency, I mostly use it in 30 and 200 potency with frequent repetition. So when the structure mind function structure is lower range, mind plus function higher range, think of alumina. Alumen in the three words, how can we describe? Hardness plus dryness plus constriction. Hardness, dryness, constriction. So when life dries, tissue hardens and functions slow, alumina comes into the action. Thank you very much for patience listening. Thank you. See you in the next episode.